Now let's find out, what impact does the committee's work have on the faith-based community?
I believe the impact on the faith-based community is the information that ADAPT brings to them. I believe that just being able to take the information that ADAPT has, information on how to get rid of unused prescriptions, to take that information to the interfaith community and to put the leaflets out on the table, and anyone coming by could pick up a leaflet and find out where they could take their unused prescriptions to avoid any family member or any visitor coming in and finding those unused prescriptions, and use them towards whatever need they needed to use them towards. So ADAPT attacked that problem that was growing in our community, and that information was able to go out to everybody.
I guess the work that the committee does as a whole, especially with the coalition of resources that comes together. You know, from the county level, we do have some people from the state level that comes to our meetings and come to our gatherings, and the different agencies that come together with their resources.
I think it has a tremendous effect on the faith-based community, primarily because personally I've always considered the faith-based community to be the staple of the community, and by working with the faith-based, I think you're able to do more work in the community because people trust the faith-based community more so than other outside entities. And so by working through the church, I think you're able to share more resources, bring more assets to the community.
We provide the faith-based community resources, tools, and encourage them to start the conversation on drug and alcohol prevention.
Well, I'm hoping that the impact we'll have on the faith-based community is to help them with some understanding of what addictions are, and for people in their churches and in their families, giving them a little assistance with how to go about treatment, how to gain treatment, where to send people for the help that they need. Hopefully we're giving them that kind of information.
The workshops and symposium provide members of the faith-based community with resources they can share with their congregation.
I believe that there has been and continues to be a dramatic impact on the faith-based community. And in reverse, the faith leaders have shown us areas where they needed help to respond to their congregants to reach them better.
The committee's work has a long-term positive impact on the faith-based community, and I say that because we come alongside our faith-based partners, we collaborate with them, we support them, we give them resources that they can utilize to help serve others, as well as remind them to engage in self-care practices, because we know and we realize that you can't take care of anyone else if you're not taking care of yourself. So we stress that a lot. We ask them to take care of themselves, to ask for support if they need it, and then we actually give them the support that they request if we are able to. And if we're not, we find resources that are available to them so that they can get the help they need in real time.
I think what really benefits the churches to a large degree is the resources and information, not only gained through the symposium, but the year-round initiatives and activities that ADAPT sponsors have been helpful. That's what I've heard from a number of the clergy and other representatives from the churches who have participated, because substance abuse within the church is no surprise any longer. It's been downplayed over the years, but the pastors and church leaders need the help of organizations such as ADAPT to, as I say, get the resources and get the help for their congregation. organization?
The impact of the work of ADAPT and those on the Interfaith Committee is significant. It provides an opportunity for faith-based leaders to collaborate with those in their communities, professionals, other agencies, and resources to engage in discussion, education, and overall programming to further the gap between the wellness of those in the community. I find it rewarding, and it is actually living out many biblical principles when we're able to collaborate in these efforts.